I want to know what your transition was like from the visiting nursing to the actual facility. You said it was neuro, right? Brain
Yeah.
injury, trauma, stroke.
Mhm.
Um, because the difference is huge, right?
Huge.
I feel like it's going from 0 to 100. I feel like that's a
Yes.
huge leap. Usually people
Yes.
jump into med surge. Maybe you want to jump into even a nursing home, a nursing facility, because visiting nursing is a very specific. If it's not a hospice situation, it's like I'm there to, just turn my patient or just like get them to the bathroom, wash them up, make some breakfast.
Mhm.
How did you go through that, right? And I want, like, what was that process like? Because dealing with one patient and all your focus on one patient to going to a facility and them telling you now you have 7, 8, and I know you're an aide, so sometimes 12 patients that you got.
So, yeah.
How did you function? How did you get through that and still decide after going through that huge leap, I still want to be a nurse?
Yeah, it was a huge difference because when I did home care, I started out working in essentially in an apartment. They had three people that they had kind of paired together with personality and whatever else they used to, like, find people roommates in this particular home care system.
Yeah.
So I had two patients, I shouldn't say patients. I'm so used to saying patients. I had two clients that were ambulatory and had some mental and mild physical disabilities. And then I had the one client who was quadriplegic, needed full cares, like needed transfer. So I had you're right, I had done it with one person. I was like using a lift, I was using gait belts. I had to be careful of like injury and safety and all that. And then going to a 48-bed unit where sometimes you're one of two CNAs. Ideally, staffing would be like 4 to 5 CNAs on a heavy inpatient unit by my hospital standards. But sometimes it was like you're on night shift and it's like somebody calls off sick, they don't have somebody else to send. Honey, you're running. You got 12 patients and 6 bosses. Or I'm sorry, 24 patients and 6 bosses. So it's different. I don't remember it as crisply as I do now. It's kind of been muted by
Of
nursing school,
course.
which was the real kind of struggle for me. But I do remember days that, I cried before going to work. I cried coming home from work, either because it was so hard or I was so exhausted. So it was a tribulation, but also I was able to keep up.
Yes.
And I was actively investing in my learning. And because the nurses there, it's a teaching hospital, so we have some level of like, there's an expectation that if you work there, you teach there, even if it's just like a student or an orientee or a coworker.
Of
So I
course.
had a lot of great nurses that were like, hey, under my supervision, do you want to do this straight calf? Like I've taught, you've learned sterile technique. You want to come in and just do it, and you're being supervised. Everything's safe. Everything's, sterile and clean. But I had these nurses that were willing to take the chance on me, be like, hey, you're in school. Come do this with me. And I took every opportunity that was offered to me. Granted, made sure my work was done first and that I wasn't leaving patients hanging. But it was intense. It was incredibly intense. I
Aiden,
don't,
good for you.
yeah.
I
Well,
feel
and
like you got some good people with you. Got some good
I do.
nurses around
I
you.
I have, and there's always that one or two people along the way that you're like, oh man, you're trying me. You're trying me.
I hear
But
you,
for the
girl.
most part, I've been incredibly blessed to not have been bullied or initiated or however you want to say it. So
Good. Yeah.
um yeah, for any of my coworkers, past or present, that are listening, like, I hope that I express my appreciation often, because I wouldn't be doing what I was doing if it weren't for like the community of people that helped
I love
raise
that.
me.
I love that you say that because I swear to God, like every nurse knows, every healthcare provider knows, like some days are you're racing. I mean, like it is nonstop, right? It is
Mhm.
hardcore, especially if you work in an acute care facility. And I don't like to brush off other like nursing facilities, but it's a different.
It's different. It's just different.
It's just different, right? So everyone has their issues, right, or their struggles.
Mhm.
But depending on who you're nursing,
Mhm.
your group is, your team, your unit, that the vibe, whatever that team unit's
Mhm.
support system at the hospital or has the facility is, it can make or break everything.